be your moderator as usually for the webinars. So welcome to the third, I think it is, Global Consortium webinar this year. So welcome. Just for the newcomers of you, the Global Consortium for Employee Health is a thought leadership forum to assist organizations that are looking to improve the health, to enhance performance of their employees worldwide for competitive advantage. So I want to start today's session underlining that our field really is or continue to gain momentum. And, the health and well-being at the workplace. More and more global organizations are taking up this issue. And some of you are probably aware that recently the UN, the nations, a General Assembly session, on how to address or battle or fight non-communicable disease. It's the first time that such a the health issue has been taken on by the UN General Assembly. And notably, part of the declaration is a long list as usual, but part of the declaration focused on the workplace. So the heads of state, they just briefly, I'm going to quote this, and then we'll get going. The state call upon the private sector to promote and create an enabling environment for healthy behaviors among workers, including by establishing tobacco-free workplaces and healthy working environments through occupational safety and health measures, including where appropriate through corporate practices, work wellness programs, and health insurance plans. So again, I think we're all in the same boat here, but it's good to see that some of your national organizations, and with this, the heads of state, are calling for this. So we have a lot of work to do. Now, with this global picture in mind, I'd like you to focus on the UK. That's our focus today for our webinar, the United Kingdom. And we're going to look at how government and industry are advancing health and well-being at the workplace through innovative approaches, I think. We've seen a lot of activity in the health and well-being field over the past few years in the UK. And namely, it's not just the private sector, as in many other countries, but also the public sector is driving this. And really why we chose to feature both sectors today, and you'll see how interlinked they are. Some of you will be familiar with the Health, Work and Wellbeing initiative in the UK, which is a cross-government initiative, and you may have heard Dame Carol Black speak. I think a lot of you have, because she's been pretty visible over the last year. Some of you know the introduction of a Fit Note, and I know Graham will talk about this, so I won't go into this. So just to make my point here that a lot has been going on in the UK, and I think it's a good reason why we're featuring it today in our Global Consortium webinar. So agenda today, I have two agenda items. Our speaker will be Graham Henderson from the Department of Health in the UK. And secondly, we're going to have Sue Connolly and Eric Teasdale from AstraZeneca. So as always, I'd like you to hold your questions, and hopefully you have quite a few, till the end, till after both spoken, or all three have spoken. And you can also, of course, as usually, type them in or raise your hand in terms of getting your point across. Just when we get going, first up is Graham Henderson. Graham is the Head of Health and Work at the Health Improvement and Protection Directorate at the Department of Health. Go ahead.
Well, Wolf, thank you very much for the invite to address this webinar. And the weather here is absolutely fantastic in London. Unfortunately, it seems to have resulted in a spate of colds and coughs and things. So if my voice sounds a bit strange, that is the reason. What I intend to do this afternoon is to set out the UK's approach to public health in its totality. And although a specific reference and specific focus upon the responsibility deal, which is a partnership between government, private, public and voluntary sector to improve public health, what I really wanted to do was to actually see within the overall context and strategy of the UK government in tackling what we certainly consider to be one of the greatest challenges to our society, which is to improve public health. And the background to this is quite clearly common to very many countries, particularly developed countries who have an aging population, an aging workforce, which obviously brings with it a whole range of potentially chronic diseases, and certainly also reflection upon our lifestyle, increasing obesity, which obviously leads to certain health conditions, and a range of other lifestyles. And whilst we're not wishing to be any status about it and try to dictate to people what they can or can't do, nonetheless, I think it is the responsibility of the government working with partners in industry and a wide range of other stakeholders to encourage people to adopt much more healthier lifestyles and generally improve the public health of the nation. And of course, in doing that, to save some of the very substantial costs which are placed upon the healthcare scheme. Prevention is far better than cure. So in terms of what is our overall goal, and really our focus very much on healthy, engaged workforces, well-managed organisations, resulting in a high-performing, resilient workforce, leading to enhanced productivity and generally contributing to a well-functioning society and better economic performance. And it is really, I think, important to demonstrate the improvements in productivity in such matters to certainly encourage employers to take this particular agenda forward with greater alacrity. I mean, many organisations do this as a matter of course. They recognise the importance of a healthy and productive workforce, but equally it's nice to know that the end product is some improved productivity, a better performing workforce, and obviously at the end of the day, you're in the private sector, better profits. Again, a bit of background to this, very much English. Professor Muhammad conducted a review to health inequalities, and this may be fairly axiomatic, but there is a clear link between employment and health inequalities, and also the likelihood of return to work. Quite a lot of statistics in this country indicating that if people are out of work for up to 6 months, that it's likely to take them 2 years to get back into work, and if they're off work for up to 2 years as a consequence of ill health, then the likelihood is they'll never return to work at all and will simply fall onto benefits. So the policy objectives are marvelous, very much to create a fair employment and decent work for all, improve access to good jobs and reduce the long-term unemployment across the social gradient, and certainly make it easier for people who are disadvantaged in the labour market to obtain and keep work. And also to improve quality of jobs across the social gradient, a clear indication that what we're talking about here, what we need are good jobs, not boring, repetitive jobs, etc. The current United Kingdom government, which, as I'm sure most of you know, is a coalition government between two parties, produced what's called a white paper. It's essentially a set of government proposals on particular issues, and the Secretary of State for Health produced one specifically focused on public health in England called Healthwise, Healthy People. Now, this is very much focused upon a life cycle. It very much adopts a life cycle approach, looking at what is needed when you're first born into our society, how you develop, how you grow up. The bit which we're particularly focusing on and which we're interested in is living, working well, choosing lifestyles and behaviours that influence health and productivity. I mean, say the others aren't important. It's just that the focus for my particular section on health and work is particularly related to that. And certainly, it is the belief that a successful delivery of that policy will certainly go a very long way to fulfilling the objectives of the March Review. I'm going to skip through these guys very quickly. You can obviously refer to them later on. I gather the whole production is being recorded. But I think it's important to understand where the responsibility deal fits into the overall strategy. And of course, in the United Kingdom, health is actually devolved. So the Secretary of State for Health is responsible for health in England, and the governments in Wales, Scotland and Northern Ireland are responsible for health there. Nonetheless, within England, it is intended to create a national public health service, first time that's actually been done, and also to return the public health leadership back to local government. This will be professionally led, both nationally and local, and even in these fairly straitened times with the recession across the world, there will be dedicated resources. These resources will be ring-fenced quite uniquely to prevent any cutbacks in the dedicated focus on public health. And all this is set out in a parliamentary bill which is currently going through Parliament. So the new public health service, Public Health England, will be directly accountable to our Secretary of State to achieve measurable improvements in public health outcomes and provide effective protection from public health threats, such as infectious disease, biological, chemical and radiological threats, but most importantly, to really help people and families to be able to take care of their own health and well-being. And obviously linked to that is the important roles of changing and commissioning partners from all sectors to certainly create the environment in which that can be done. So Public Health England will be very much the delivery arm of public health, outward-facing and supporting the front line, whilst the core department will continue to be responsible for national public health policy. One of the key roles would be the creation of a Director of Public Health who will be appointed by the relevant local authority as second-tier authority, and Public Health England will be employed by the local authority, but will be the principal advisor in all health matters to the local authority, its elected members and officers, but will have a key role in the proposed new functions of local authorities in promoting integrated working, and will jointly leads the development of the local joint strategic needs assessment and the joint and health and wellbeing strategy, which will be developed at local level. Really very strong emphasis here being placed on a local response to local needs, which is why it has been devolved back to local authorities. And a critical element of this is the creation of health and wellbeing boards, which will be established by April 2013. They are actually in the process of being set up. I think short than about two-thirds of local authorities in England have opted to bring these into force early to effectively try them out. They all have a minimum membership of at least one elected representatives of each relevant general practitioner consortia. That's very much focusing upon primary care. The directors of public health, adult social services and children's services. Local health watch representative essentially in this country is someone to look after the consumer's interest, the patient's interest, and also representative of the NHS Commissioning Board. But quite significantly, particularly within the field of health and work, other representatives can be appointed by the local authority and or the Health and Wellbeing Board. And we're certainly keen to get organisations from the public, private and voluntary sectors involved in these boards because they're clearly integral to the local employee workforce, etc., and need to have that very important input. A bit more about health and wellbeing boards. Clear duties on GP consultant to prepare this joint strategic needs assessment. Again, very much a local response to local needs and thereby to develop an appropriate strategy. In order to ensure that we measure what's actually being done, various outcome frameworks have been established or are in the process of being established, two which have been confirmed in relation to the NHS framework, employment of people with long-term conditions and the other employment of people with mental illness. The ones listed, the public health outcomes framework, they're now in the process of being determined. In fact, I think it's most likely that the four are going to be amalgamated into two, focusing rather more on the difference in the proportionate employment of able-bodied people and people without mental health conditions, for example, and those with either health conditions or mental illness. So those are likely to change. But clearly it's important you do actually have outcomes, because otherwise there's no way of measuring what is actually being done. We've also got a range of other initiatives. Wolf mentioned particularly Dame Carol Black, who wrote a seminal report in 2008 focusing upon the health of the working age population, and she made a number of recommendations which resulted in initiatives such as the Fit for Work service pilots, which are still taking place. Much testing out the proposition that early intervention to get people back to work within the first 6 weeks is more likely to prevent them falling out of work, and many of those pilots are going quite well. There's also the fit note. Instead of having a sick note in which the doctor signs people off sick, there's an additional box for the doctor to consider, along with the employee and also with the employer, whether there is work they can do. I mean, recognising, for example, that somebody sprains an ankle, they may not be able to go into their workplace, but, for example, may be able to work from home. Some reasonable adjustments which can be made to that. And initiatives, public health responsibility deal, clearly quite an important one. New provisions in the Equality Act, which makes it, for example, unlawful to discriminate in employment in a range of different issues, but also in terms of pre-employment health checks as well. And so, for the very first time, we've introduced a new system to accredit occupational health services to ensure that they do actually deliver according to a particular standard. So moving right on to public health responsibility bill, this was launched by the Secretary of State on the 15th of March, and as I said, very much involves the business community, voluntary sector and NGOs working together to recognise their vital role in improving people's health, encouraging and enabling people to adopt a healthy diet, foster a culture of responsible drinking, encourage and assist people to be more physically active, which is quite a serious problem in this country despite our devotion to sport, and actively support our workforce to lead healthier lives. And there is an overarching board chaired by the Secretary of State. The responsibility deal is delivered through 5 networks: food and alcohol, which are very much externally facing, more to do with manufacturers pledging to, for example, reduce levels of fat, particularly saturated fats, calories, etc. Also in terms of alcohol, particularly focusing upon the marketing, but also on networks on physical activity. They have changed because that's really what we're about. How do we actually change people's behaviour? But the one which I'm responsible for, health at work, and the relationship in particular between health and work. In terms of what our particular network has been doing, our objective is very much to find ways to help employees use the workplace to improve the health of employees, and also, where possible, customers as well, and contractors who may work in workplaces. So, I mean, our current work, which is contained in a series of pledges, which so far up to 300 organisations have joined the responsibility. Over 150 have made a pledge to at least one of the current 6 pledges which we have under the Health at Work network. This is still very much work in progress, but people are beginning to recognise the importance of this and are looking to sign up. So one of the most important pieces of work we did, recognising the growth in chronic conditions amongst the ageing workforce, to produce a guide on how one manages it. A lot of evidence to suggest that it isn't always done very well. 2 large companies and a medium-sized company, Unilever Mars and Novo Nordisk, undertook to mentor small and medium-sized enterprises in their localities. And this is a project, individual pledge on their part, to try to encourage SMEs to adopt health and wellbeing responses within their particular localities. And this is a project which is ongoing and will be reviewed at the end of 12 months, which will be sometime about April of next year. But it's a very effective way in which large organisations can help smaller organisations adopt a much more positive health and well-being approach. I've already talked about occupational health services being accredited, but part of the responsibility is to make them much more proactive and preventative, something which certainly in this country they're not particularly good at doing. Really, it's very important if you're going to start out on this particular agenda to make a very public statement of what you are going to do. So there is a particular pledge committing to public annual reporting on health and well-being, including sickness absent data, and to establish the veracity of your commitment, but also to show gradual improvement over a period of time. A fourth original pledge was to do with healthy and sustainable food, focusing upon restaurants, canteens and other food outlets in workplaces, and a pledge to reduce saturated and other fats, calories and salt, etc. We did actually launch 2 new pledges, and again we'll sort of touch upon the importance of some of these, but we had a poster workshop in which 70 people from 40 different organisations attended, and a number of organisations, about 15 or so, produced posters on how they were actually implementing the responsibility deal. It was an extremely successful event, but after that event we did launch 2 new pledges, one on smoking cessation and lung health much more generally, that is to encourage employers to make available at work smoking cessation courses, etc. And the second one to encourage employees to undertake various health checks and assessments, which are available through NHS Choices and also through the NHS and through a wide range of other organisations. Our future work is 2 particular projects currently in hand. First of all, improving workplace adjustments, particularly for people with mental health conditions, and an area which has been identified where perhaps employers are fairly weak, and also recognise the importance of getting the message across to people at a very early stage in their work lifestyle to encourage and help children, particularly young people, to understand health risk before entering the job market, and to get employers to commit to inducting young people in healthy workplace and healthy lifestyle responses. So that was it. It's an enormous agenda. Hopefully I haven't gone too much over time. But that hopefully sums up what we are trying to do in the field of public health. Thank you.
Thank you, Graham. Thanks for your update and insight on the responsibility deal and the work the Department of Health is doing in a larger sense with health at work. So just so we keep with our time, I'm going to go to the next presentation. Then we can discuss and you can ask your questions afterwards. So we have the private sector next, and we're very glad to have AstraZeneca. A very advanced program, not just in the UK, but globally, as you will hear. So we have 2 speakers. We have Sue Connolly, the Global Health and Wellbeing Manager, and Eric Teasdale, who's the Chief Medical Officer. And both focus on health and well-being. Like 95% of the workforce who are at work in an effort to improve their energy levels and learning how to best use their energy to be productive at work, as well as enjoying life more, rather than just focusing on health, traditionally focusing on sickness absence. So that they're both focusing on. So I'll hand it over to you, Sue and Derek.
Thank you. I'll start off and then hand over to Sue. You can see the word we've picked here to symbolise good health and well-being. If you've got a lot of energy, it's likely you're well, healthy, and you need to be able to do a couple of things: make a good contribution at work and enjoy life, which is what we all want. First picture shows the fact we're global. Now, we're headquartered in the UK, in London, but we have activities in something like 105 countries and more than 60, a substantial set of people. And you can see here with this picture of Japan, one of the major countries where we're trying to work to make drugs and to make progress. So we're a big company. The actual details on this slide don't matter, but just to give you an example, we have something like 62,000 people, plus a lot of contractors, temporary people working with us. We're committed to a responsible approach to business, and we see health, well-being and safety as fundamental company issues. And we're obviously growing reasonably fast in emerging markets such as China, Brazil, India and Russia. The objectives of our program are to inspire our people to embrace health and well-being personally, so they take responsibility to improve their health and well-being, supported by the company. We do not want to be patronising or paternalistic, act like mother and father. We want people to really want to do this for themselves. But we'll give them the tools, give them the education. And that, we hope, will lead to a more energised environment at work, and also they'll get more out of life outside work. I won't go through all the words here. We have a tagline, Health Connects Us All, because we work with doctors, we work with people who pay for the medicines we provide, such as governments, and we're all connected together to try and improve health, and where to start them with your own employees. Our own employees obviously make the business, and we want them to feel fulfilled at work as well as outside, and generate a good working environment. So the tools, education and training are part of what we're trying to do, and we're trying to move all of this forward. And we think that people have to be actively involved in their own health and well-being management, and we want a dynamic and positive working environment, and so people can be productive. Of course, the world is a pressurised place, probably become more so. We want people to have the skills to handle all of that. So we entered a paper to our senior executive team. This is the chief executive officer and the 7 other people who make up that team, head of all the major functions, research and development, supply, manufacturing and sales and marketing, plus the additional functions of finance and legal and HR, etc. And we base our work on this concept of energy levels. We want to help people improve and maximise their energy and then use it. And it's not just about what you eat, it's not about exercise, it's about how you use your energy, the emails, the meetings, the way we have to organise ourselves to get the job done. And industry is really based on innovation, and we want to be productive. And we know our people, such as all those on the call today, want to enjoy their lives. People are undoubtedly our greatest asset, the human resource, and want to work across the whole of our company. But in doing all of this work, we've been told, don't make this another new initiative. Work what you're doing into the business model, into the way we roll out the number of issues and activities we have in the business already. Now the framework is, you can see here, it's got 3 parts. The first is personal energy management training. Now you may say, why do we do this? Well, most people are pretty good at managing departments or sections. Other people, they're often very good at managing projects, and what they're very poor at is managing themselves. Now it's not to say don't start out that way, but life takes over. Busy jobs, busy life, maybe kids, aging parents, and suddenly making time for yourself, looking after yourself, staying in good shape, maximising your energy takes a back seat. It is not getting the time and attention it deserves. So we want to remind people a whole raft of things. We'll tell you more in a minute. The thing is health screening. Most people on the call will have a car or a motorcycle. I would imagine you look after it well. If it has a bald tyre or the steering is not effective, the suspension's not working well, you get it fixed. But why don't we look after ourselves the same way so we can perform well? So it's looking after our physical, our psychological well-being. Then we have a raft of 6 essential health activities, which I'm hand over to Sue to tell you about all of these 3 things.
Okay, so that's the theory, and now we're going to put it into practice, and I'll go through just a brief outline of these 3 parts of our strategy. Erica said about personal energy management, we're trying to embed this into the organisation. Managing your energy is not necessarily a learned skill, but it's something that we should pay attention to. What we're doing is embedding this training into existing business processes, and we have a suite of training facilities available called AZ Academy. So what we're doing is embedding this training within the Academy framework. Based learning, that's really your workshop, that's your face-to-face, and this is where we We'll be training our top 200 managers so that they can not only endorse health and wellbeing and energy management, but they can actually actively practice it. They can cascade it through the organisation. Relationship-based learning, that'll account for about 20%, and that's where we'll have coaching via line managers is concept. And the majority of the training, it'll be on the job, actually experience-based, looking at ways of working, looking at work-life balance within their own teams and their own personal lives. So it's 4 areas for this personal energy management: the ways of working, how you actually physically do your job, how you manage your workload, manage the relationships, the job design. Just think about rest and recovery, so making sure that you have the right nutrition levels, you're hydrating during the day, and you make sure as well that you're able to recharge your battery through rest and recovery, whatever that means to you. Looking at resilience, because we make sure that people have the mental capacity to deal with the demands of busy jobs and lives. We also want to look at focusing on the future. So if we've made an assessment of both our professional and our personal life, we want to think about, if I continue at this pace, in this way, for the next 20 or 30 years, what sort of state am I going to be in by the time I get to the end of my working life? And for many of us, that's going to be an ever increasing age. Health screening, as Eric has alluded to, we want to ensure that we want to look after ourselves. There's doubt that where health screening is in place, whether that's within our UK environments or globally, it's valued by our employees. We have to ask ourselves the question, are we focusing on the worried well? How do we know that the type of intervention that we're putting in place is appropriate? So we looked at the evidence base to support certain interventions from a health screening perspective. We developed a standard and guidelines to support this. So there's a tiered approach of level 1, level 2 and level 3. And I say this is done from an evidence approach in terms of, do you get feedback for the type of medical interventions, the type of medical assessment that people are going through. So for level 1, this is our minimum, and we will expect areas in our organisation to provide at least this level, and that's the screening for obesity, blood pressure, depression, excessive alcohol consumption, tobacco use. And onto that as well, there will be follow-up for counselling for these areas. If an area has either the financial and or the service provision availability, they can look at the second level, the screening for lipid disorders and type 2 diabetes. On the level 3, the higher level, again, if there is the availability from both a financial perspective or a provider perspective, these are the areas from a cancer's perspective that we think are worthwhile and we know from the evidence base. But all aligned to this, we want to make sure that there's follow-up so that people actually take action. We know that people who have a health screening, they highly value it. They may look at the results for the first week or two, do something about it. Then life gets very busy and they end up putting the report into their top drawer and they don't really think about it until it's time for the next screening, and then worry that perhaps they should have done something about exercise levels, or perhaps they should have done something about their weight. So to include for this, to encourage people to take action. Our third area is our essential health activities. Again, this is taking an evidence approach, looking at what are the most effective interventions, and these will be promoted within the organisation, and we've got targets in place that will be met by 2015, and there's a glide path for that. So for instance, we want to make sure that over 8% of our sites are marketing companies, and that means all of our large facilities have one of these activities in place by 2011, and then we have a rollout to all in place by 2015. The areas that we've concentrated on are on the slide here, and you can see that they align very effectively with the previous presentation on the responsibility deal. Looking at physical fitness, as a company we've been involved with the Global Corporate Challenge, which is an external company that does a pedometer challenge, and over 111 days you do 10,000 steps a day, you walk virtually around the world. And this year we're very proud to have been awarded the world's most active organisation by the GCC. That's out of over 1,000 companies taking part globally and over 130,000 participants. We want to make sure that where people travel on business, understand the risks for that and make sure they have proper immunisation in place, and also they understand the support that's available from a medical and a security perspective, eating, make sure that people have mental resilience in work pressure management, health promotions, whatever the risk is in your particular area, and tobacco cessation. In terms of where we're up to, you can see we are looking at personal management. We have piloted a number of providers of that and making recommendations into the business. In 2010, we did a baseline measure in terms of what is available with AstraZeneca for health screening, and we have 67% of our sites and marketing companies are actually providing some form of risk assessment for their employees. We have developed a standard and guideline that's communicated globally so people understand what the expectations are and they understand the levels 1, 2 and 3 that we've put in place. In addition to the essential health activities, that's aligned to our SHE strategy, and again the baseline survey said that we had lots of activity in place, and we're due to track that again in the next month. And some standard guidelines again have been developed and communicated so people understand where they need to be in this area. To support the strategy, we've had a governance group formed, we've developed some matrix to map where we are and to measure our input. We have a global wellbeing index, which is really our stress risk assessment based on our employee opinion survey, the global corporate challenge I've spoken about, and we've communicated to all our business travellers about the support services that are in place for them. We have some global regional leads that are aligned to health and wellbeing, and they'll be tasked to take actions, as you can see on your screen, to make sure that our strategy is being embedded into the organisation at all levels. We'll have some ambassadors in many locations, and again, they'll be responsible for taking on actions that are culturally acceptable in their particular area. And we have ideas and programmes and materials, and we expect some feedback from those areas about the good work that they're doing so that we can share them in the appropriate locations. So if it's around Europe, the type of activities have taken place. If it's in Latin America, the things that are culturally appropriate there. We have developed some measures for success and listed. Now some of these are within the health and wellbeing strategy, and the strategy will directly impact them. For others, we believe that we have a contribution to make towards the matrix, but they're not necessarily completely within our control. And need support from the top. So it's important to get high-level commitment, and this is a quote from our Executive Vice President in HR, who is a member of our senior executive team. To say that we believe in health and well-being, we believe it will have a positive impact on our health-related costs, on our employee engagement, on our work productivity, and of course, ultimately, on our business performance. And this will make sure that we have sustainable high performance. And finally, these are some of the challenges that we face over the duration of developing this strategy. Now, I know it takes time to develop these strategies, especially if you're going into different areas, different markets, and from our experience, it takes a lot longer than you would expect or indeed that you'd want. We know that resources can come from many areas, so whilst we have a small team in AstraZeneca, we've been able to engage with some of our business partners and get them to communicate and to take action in terms of health and wellbeing in their respective areas. You have to make sure everyone is aware of what you're doing, so communication is key. And also, as I said right at the beginning, this is to be seen as a new initiative. We have to embed our ideas into the organisation, and we have to weave it into the fabric of the organisation. So health and wellbeing is just something that we do in AstraZeneca. Okay, thank you.
Great, thanks so much to both of you, Eric and Sue. So now we have, I think we have around a good 15 minutes here, time for questions. While you are seeing your thoughts and thinking of questions, let me kick it off. I have one right away for Eric and Sue, because just as a follow-up to your presentation. What's your take on the responsibility deal? Like, for example, have you signed a pledge, and what do you think? What can it do for the field of health and well-being in the UK?
Yes, we have signed the pledge, certain aspects of it, and as you can see, we're building on a base which we've established. So we've much done a lot on the Get Fit, the physical exercise, the healthy eating, doing in a sensible way, and we're actually working with the providers. These days, very often, the people who do the catering and vending machines are contractors. We use one in particular, and we've built into the contract them having healthy options, them doing some of the promotional work, and making sure the healthy options are available. There is a lot still more to be done in any of this and in all of this. I wouldn't like you to think it's job done. So, for example, in the US and AstraZeneca, they've had a good go at looking at their vending machines. They try and put some of the healthy options at eye level, things like apples, nuts, etc., and take some of the gooey, sticky stuff away completely, or put it in other places so it's less visible. You have to give people a choice. We're not goody-goodies trying to spoil people's fun or enjoyment. We all enjoy a nice cake or whatever, but we're trying to sort of get it to a point where people start to have choice and take sensible choices. And also, as Sue said, the health screening, in fact, we offer health screening already throughout the United Kingdom, all our sites, all our employees, doesn't matter their status, their position in the company, they all get the chance to go along below the age of 40 every 4 years, over the age of 40 every 2 years, and they get a very comprehensive health check. But one thing that's really missing, and it's important for us to describe some of the things missing as well as what we've achieved, is we think follow-up is really important. So take me as an example. For a number of years I've been told, I'm a foot too short for my weight, my cholesterol's up a bit, my pressure should be looked at, take more exercise. And it's so easy when you get that information to worry for a couple of weeks and then ignore it. So what we really need is someone to phone you up and say, hey Eric, hey Sue, whoever, this was found in your check, do you do something about it? And then you get somebody who just gets you along and gets you thinking about what you're going to do differently. It does help. So yes, we are signed up to the responsibility deal. Yes, we are pushing forward across that. We're also signed up to a number of other things like the Wellness Alliance, the World Economic Forum. But we're trying hard to make sure health gets embedded in the minds of our employees in the UK and globally.
Okay, thanks, Eric. That's good there. Do we have any questions at this point?
It does look like someone's asked a question. It's from VLife. It says, and it's to Graham actually, if companies don't fulfil on the pledges they make.
Right, well, this is very much a voluntary agreement. I mean, the whole of the responsibility deal is based around corporate social responsibility. Now, clearly, this was a major program launched by the Secretary of State, who there's a reasonable expectation that it will actually monitor the progress. I mean, the general philosophy behind it is that you can achieve very much more through voluntary agreement than can through legislation, which of course only deals with minimum standards, usually reducing people from the very bottom up to the minimum acceptable level. So one of the core commitments that in signing up to the responsibility deal does is to agree to monitor what they're actually doing. Clearly, I mean, in all walks of life, in all walks of work, I mean, that's what you need to do to monitor that you're actually achieving something positively, and that certainly goes for employers and workplaces. So they did make that original commitment. I mean, clearly, if an organisation, for whatever reason, decides that it wants to withdraw from responsibility deal, or they suddenly decide that they can't be bothered with filling in what we think are fairly sort of straightforward monitoring templates, then there is no sanction whatsoever. That they entered the scheme voluntarily, and clearly they can leave voluntarily. But I mean, I think it would probably be somewhat embarrassing to those organisations were they to do that, but there's certainly no formal sanction as such. But fairly confident that the overwhelming majority, if not all of the 300 organisations who have so far signed up, will certainly fulfil that monitoring objective, and will come April next year complete the relevant part of the form indicating what they have done over the last year to implement the various pledges they have signed up to.
And for those of you following the global consortium for a while, you know the CSR angle is really, it's not just goes on the UK as the WHO is pushing this strongly too in their healthy workplace framework, that it's it's not just about legislation, but being a good employer, being a socially responsible employer. That's part of it, to promote healthy lifestyles and providing the environment to do that. So just to remind you, you can, for a question, raise your hand, you raise the hand icon, or just type in the question in the Q&A section. I see Sharon has a question from British Gas.
Yes, Sharon does have a question. Unfortunately, I can't identify her. There's no caller ID for it, so there's no way I can unmute around 15 different callers. So unfortunately, Sharon, if you wouldn't mind typing your question into the chat console or the Q&A section, I can definitely read that out for you. In the meantime, we do have a question from Shannon Sorrell, who says it's actually a question for Sue at AstraZeneca. The question is, what type of screening is being done for alcohol and tobacco, and are they biometric tests or just self-assessment?
Hi. Well, I guess the answer to that is it depends. It depends where you are globally. It is done by self-assessment through an electronic risk assessment, or there are other ways where you may have actually a one-to-one with a medical professional. So, and in the UK, it's a one-to-one with a medical professional.
And did you say they were biometric screenings, or are they self-report? Depends. Okay, it would be.
But in the UK, have a battery of biometric testing that takes place. Other parts of the globe, it may just be a electronic self-report questionnaire.
For example, in the UK, check liver function test and respiratory function with a Vitalograph or similar spirometer to see if there's any effect. And of course, if there is, it's a hopefully powerful indicator that something needs to be done in terms of behaviour change.
Okay, that's good. Have any other questions?
Yes, sure. We have one from Rashri Chatishra, who says, how did you recruit and engage with the Wellbeing ambassadors?
Well, in a couple of ways. First of all, Sue and I are part of Global Benefits. Part of changes taking place right now, we're putting into post people who are regional benefit leads. And 30% of their job is not just the pensions and the rewards of different kinds, it's actually health and well-being. So we have a formalised 30% of your job is health and well-being. So they'll be trained by us the things we want done. They will know about the different things we want done and by when, and they will promote it in the different, we currently have 5 regions where we operate around the globe. That's the formalised bit. In terms of ambassadors, we're keen to have people who are champions, ambassadors, whatever you want to call them. We prefer not to have health professionals. We prefer to have managers, and managers if possible, who really believe in good health and well-being, and not only promote it but live it, so they can be seen to taking exercise, to doing the sorts of things which are likely to, and you can actually see, improve their own health and well-being. They're the kind of people to have. Some are volunteers, some are cajoled into it, and some is a formal line responsibility.
Well, that's good. That's a lot, I think, compared to some other companies. Very good. Any other questions?
Yep. We have Claire Gibson from Capita, who asks AstraZeneca, how are AstraZeneca proposing to measure the impact their wellbeing program has on the productivity?
Good question.
That's hard to do because the connection seems to be good health and well-being leads to better engagement. Engagement leads to higher productivity. For of course, if we get 1 or 2 really good ideas from the world of chemistry or biology in terms of new products, which were desired effect in a therapeutic area on a particular disease, that's really the mark of how successful we are. So good health and well-being are part of the many things which will hopefully create the atmosphere and create the structure so people can perform well. And we'll know if we have a good weekend, we're happy, we're cheerful, with a rest, a good sleep, we feel better, we perform better, we rattle through the work, at least until we get tired, at which point we need a good rest and then start again. But often happens is we put ourselves in a poor physiological state and we're not in good shape to perform. So the is not direct, but I've got no doubt that good health and well-being does increase productivity.
And I think the other thing that you have to take into consideration, we have developed some matrix to help support the health and well-being strategy, but also we don't want to make a cottage industry out of this in terms of measuring everything, setting up certified research projects. We want to make it as clear and as simple as we can to engage with senior management.
And our metrics are in fact, to use the pun, focus, because we have an employee opinion survey called Focus. With 70 to 80 questions annually, everyone around the world is asked to contribute to actually take part in that survey. And we worked with Lancaster University to pick out a number of questions and validated those questions and answers. And those 9 questions help us get a global wellbeing index. Now, wellbeing is a complicated topic. One of the things that's most important is good leadership. So not surprisingly, some of those questions relate to the standard and quality of leadership. The people support you, mentor you, coach you, listen to you, help you, communicate with you and tell you things. So it's perfect, but we're doing the best we can to get the metrics which will show that we've got a healthy and well workforce.
Or challenge, right, to find that balance of metrics without becoming too academic. What else do we have? We have another question?
We do have another question to get for AstraZeneca. How are they approaching ongoing engagement of health and well-being and the biggest challenges globally?
Okay, we have challenges in the business. As I've alluded to, new products is the biggest one. And what we're trying to do is to weave, as we've said, what we're trying to do into the general framework. If the global health and well-being in AstraZeneca are represented in total by the 2 people talking to you this afternoon. We make use of other people, and it's quite surprising. Just last week, the 2 of us were at a health and wellbeing conference in the US, and it's surprising in AstraZeneca how some of the language is starting to change, and people are starting to recognise the benefits of a few behaviour changes. So, for example, we've done so recently on work-life balance. We attended a symposium which was also attended in part by the chief executive, called Work-Life Success. And other things, it recognises we now live in a 24/7, 365 world. So it is important to ensure you're not working all the time. you do get disconnected, and your BlackBerry or iPhone are not ever reminding you about work. Because if you work too long, too hard, too often, your performance will suffer. We all think that working longer and harder will make us more productive with more output. It's not true. Get to a point where you really do need to switch off, recover, rest, and that's what we're trying to do. So the health and wellbeing messages are really starting to get out into the business. We don't have uniform or consistent or comprehensive success. I think we're starting to make some inroads.
Let's take one more. I think we have 2 more minutes, so let's take one more question because we have so many, I think, right?
Yeah, we have another one. How do AstraZeneca, how do you currently track the return on the investment of their health and wellbeing initiatives?
We 3 months last year working with an accountant out spending money, and if we spend the same or more, what the return would be. The problems is, first of all, very hard to measure. Secondly, that you're really dependent on participation. You provide as many programs as you like, but if people don't participate, then you're kind of wasting your time. And that's why we were literally thrilled this year to have over 5,000 of our staff take part in this exercise challenge. A lot of them said, I really didn't believe in it, but I really feel a lot better now. I sleep better, more energy, I've lost some weight, which all helps. And I'm more engaged, I think I'm more productive, I think I have more ideas, I'm a better team player, better individual player. So it really is part of that big picture of trying to get this on the map.
The other thing that we do is we take evidence externally. So where there are academic published papers that give you ROI, and we make sure from our perspective that those studies are valid, then we take that evidence base and we're not going to recreate that within our own environment. We're very fortunate in a sense that we have operations in the US and they have a different system to healthcare funding than we do in the UK. They are more able to provide an ROI for some of the health interventions because they have to track their healthcare spend. So we get that information and we use it on a global basis. Why should it be any different in the US to the UK or elsewhere in the globe? So we don't go through a massive exercise in terms of making those claims ourselves. We take external evidence as well. Just
one point on that to answer that question. For a time in my career, I was Vice President of Safety, Health and Environment for Zeneca Pharmaceuticals. And I came to the realization that people, in financial terms, understand safety and environment better in that if you have a fire, an explosion, environmental contamination, you might talk about 10 or even hundreds of millions of dollars or pounds. It's big bucks, it's big spend. I think mental health, it's lots of little things like sickness, absence, people not quite performing as well as they could. If you turn that around and have real health and well-being, again, you're hopefully putting a little bit of extra fuel into the engines of all the different individuals in the company so they will perform better, whether it's innovation, whether it's production of packing line, whether contributions to a team. It's just hyping things a little, it's making people better contributors. So very hard to measure the return on investment. We found that, but I think in practice, a lot of people, including a lot of senior managers, have said, we believe good health and well-being is a part of performing well.
I agree with you, Eric, absolutely.
Okay, well, I think we could do a whole other webinar on this measurement issue because, quite a few of us are asked to provide the proof, so to say, so we don't always have the environment to do that. But, of course, the big picture we have to see at the same time. Unfortunately, we're at the top of the hour or even past, so I should probably close up. I'd like to thank all of you for joining. Please provide us with your feedback, as always, and interests that you may have for future webinars. Just briefly, our next webinar will be in late November. Well, that will be announced very soon, and we will focus this time on the Middle East, on UAE, actually, the United Arab Emirates, and we've got some exciting things going on there also with the government initiative. So join us again then, and thank you again, and I wish all of you a nice rest of your day. So thanks a lot to the speakers especially, and goodbye.
Okay, thanks.
Bye-bye.